So I'm Dr. Nikhil Samtani. I'm an international medical graduate, and yeah, looking to get into residency, and med clerkships is helping me do so.
Okay, so what is your overall feeling about med clerkships?
It's a great company, and like we were discussing earlier, that's what I love about it, and I love the whole. There's nothing to hide attitude, so whatever I ask, you guys always have an answer for me, so I like that about it.
Can you describe in detail one specific experience that you've had that you're happy with med clerkships?
Recently, when I requested about the LOR, the letterhead, I had a query about what exactly would be mentioned on. And even though, for me, a lot of these programs, once you make the payment, they don't really look after your students. They just set you up with the preceptor and it's gone. That's what I've heard from, other programs. So, so the fact that you guys still answer my questions within 6 hours, 12 hours, I got a reply. So I was pretty impressed by that. I wasn't expecting it.
Okay. And can you describe one or two benefits that you've gotten from med clerkships that have helped you the most and that you value the most?
Yeah, the whole concept of getting an experience in an hospital that has an ACGME accredited internal medicine program, which is my eventual goal, and the whole access to the EMRs, which was new for me from back in my country. It's everything paper, right? So over here, access to EMR, it may sound simple, but once you have a problem, if you're used to the system, you get to figure it out, and that happens only with practice, and we got a lot of practice, so pretty impressed by that.
Okay. And would you recommend this rotation and preceptor?
Oh, without a doubt. Dr. V was unbelievable, and he's literally one of the best professors or teachers or preceptors that I've ever worked with. And like I said, he likes to teach, and more importantly, he loves to learn from the students as well, because he knows that everyone has a different set of experience, from their own different countries. So it's great that he's always open to opinion, and he's always for discussion. So even though I haven't seen the patient myself, I feel that I have, because he discusses it in great detail, and it's pretty awesome.
Can you describe your precepting, like a precepting session? You were looking things up on the electronic medical record, and then did you feel some autonomy over the patients that you saw as well?
Definitely. Like what he used to do is we used to get a patient, this patient's available, right? And since we were a group, so we used to work in a team, like how it is in residency. So 3 of us used to go see the patient and ask the questions, required questions, and make the notes in the EMR and present the case to Dr. Valerie. And not just present the case and ask him to do the assessment and plan. We used to do the assessment and plan by ourselves, and he used to be like, okay, hey, you guys messed up here, this is what I would do, or this is why you think you were right, but in actuality, in clinical practice, it's different from theory practice. So it was a great experience in terms of like the variations in inpatient and outpatient management of conditions. So I really appreciated that. And then sometimes if he liked what we did, he wouldn't even, he'd just sign off and be like, I trust you guys, like take care of it, so.
Great.
It's good.
Okay, how did you find your housing?
Okay, so I had an option of either getting an apartment here or staying where my family used to stay in New Jersey, which was it's far away. So I chose to stay there to save on rent, but if you're really interested in learning, so I didn't care about the commute. So I traveled about 2.5 hours each way. So I drove to the station or took a bus, depending if I had the car in the morning, and then I used to take a train to New York and then the subway to Brooklyn. So it's quite an experience, but it's worth it, definitely.